Active Life in Sports is a therapist-owned practice. Joe and I own the practice. We think that's important because you as the patient come first.
Mainly working with the patients, providing an excellent environment for the patients to recover.
Our philosophy tends to be a very active approach involving the patient in their own care. Understanding the condition that you have and the things that you need to do, takes away the fear and helps you become more involved. When I work with patients who have been to other physical therapy centers, the thing that I hear pretty often is that you guys here really challenged me more than I've been challenged in the past, and they really have appreciated that we provided that progression.
I hear all the time patients come in and talk about our staff, and they talk about how great it is to work with them and how much fun they're having while they're working. And to me, nothing gives me more pleasure than knowing that that our people are really interacting with our patients and making sure that that they're treating each patient like a family member, like part of the Active Life family.
So when we're looking for physical therapy staff, the first thing that we look for is people who really enjoy being around other people, who can engage and make people feel comfortable, make them feel special.
We want to see somebody that is able to interact with any person that walks in the door.
We also look for lifetime learners. If you're practicing physical therapy the same way you were 4 or 5 years ago, then you're not really practicing with where the evidence is.
We encourage people to continue their education above and beyond their Doctor of Physical Therapy degree. One thing that Active Life certainly looks for is people that are willing to go the extra mile and get additional certifications, because we believe the patient in the end benefits from that experience. They benefit from that additional knowledge and skill set that the therapist can bring to the table.
I think one of the things we stress with therapists is being present in the moment. Each time that patient comes back in for a follow-up visit, we want to know how you did after the last visit, how you're doing with your home program. Do you feel like you're making progress, so that we can make adjustments to your program, either progress you a little faster if you feel that way, or back down a little bit if you feel like it was making you sore.
That's really what skilled care is about. It's about making clinical decisions based on how the patient reacts and responds to the exercise or to the intervention that you're working with them.
We also like to make the process as much fun as possible. It doesn't have to be a miserable experience because you're in rehabilitation. So we try to really engage people and try to find ways of making it interesting.
Fun for you is fun for us. We want to enjoy coming to work every day, and we do.
Outside of the basic injury, I think there are two things that people bring when they come to physical therapy, and one of those things is fear. They don't quite understand their diagnosis. They're afraid that they were going to live with pain the rest of their life, or that their surgery won't turn out. And so one of the first things we do is try to get a good assessment on what the condition is, and spend a lot of time on education to help you understand that, to help you, to empower you as the patient.
And that's the reason it's important to seek professional physical therapy and assistance. Your program is going to be individualized, and it should be focused on your goals, on getting you back to your passions. We are the musculoskeletal experts. We deal in movement of the musculoskeletal system.
I've never had a patient that was sorry that they tried physical therapy before they tried surgery or narcotic pain medications.
It is the least invasive option for the start of your care. We want you to be a part of the Active Life family.